Many people believe that oral sex is a completely safe practice with no health risks if you think the same. I'm sorry to say, but this idea could cost you dearly, especially if you are between 60 and 85 years old and don't pay attention to certain details that make all the difference. There are silent diseases that can settle in the mouth, throat, and even the urethra without showing any signs at first. By the time symptoms appear, the problem may already be advanced. Avoiding these complications is easier than it seems. Small habit changes. Protect your health without compromising your intimacy. I am Dr. Rita Rossi, a urologist, and in this video, I will show you what no one talks about. Regarding this practice, I will explain how certain microorganisms spread what the most common infections are, and most importantly, how to protect yourself effectively before continuing check. If you are already subscribed to the channel, this ensures that you receive important content about health and well-being. If you like the topic, like the video, so this information reaches more people. Now let's get straight to the point. Internal fluids and the fact that hardly anyone worries about this topic create a false sense of security, leading many to ignore the risks, believing that this practice is free of complications, can lead to unexpected consequences. Think about this. Would you clean a dirty glass with just a napkin and drink water from it again? Probably not. But when it comes to oral sex, many people neglect even the most basic precautions. The mouth harbors millions of bacteria, and the intimate area has its own flora. When these two worlds meet without protection, it opens the door for infections and viruses to settle without the person noticing. What worsens the scenario is that many of these diseases are silent at first. HPV, for example, can go years without showing symptoms, while causing dangerous changes in the cells of the mouth and throat. Herpes can be transmitted even without visible sores, and candidiasis, which seems harmless, can spread to other parts of the body. Ignoring these risks can take a toll on your health to contribute to a healthier and more satisfying sex life. I have prepared the digital book Rediscovering Intimacy, Healthy Sexuality After 60 in it. I gathered practical guidance to strengthen your relationship, overcoming physical and emotional challenges with strategies that reignite passion and connection. In Marriage Access is in the first pinned comment. Don't miss this opportunity to transform your love life. The mouth is a complex ecosystem. Millions of bacteria live in it every day. Some essential for health, others opportunistic, waiting for a chance to multiply. The balance between these bacteria keeps everything working well, but when new agents come into play, the situation can change quickly. The oropharynx, which connects the mouth to the throat, has a sensitive and moist lining, an ideal environment for viruses and bacteria to settle contact with mucous membranes during oral sex can introduce these agents directly into this region, starting infections without the person realizing it. The problem is that many of these infections do not cause immediate symptoms. HPV, for example, can remain dormant for years before causing lesions in the mouth or throat. The same happens with herpes, which can be transmitted even without apparent signs. Another important point is that some bacteria from the mouth do not belong to the intimate area, and vice versa. When they end up in places where they shouldn't be, they can trigger inflammations, persistent mouth sores, and even more serious infections. Small wounds in the mouth, often unnoticed, can serve as entry points for harmful agents, facilitating disease transmission. HPV is a tricky virus. It can enter the body silently without pain, without visible signs in the case of oral sex. It settles in the mucous membrane of the mouth and throat, where it can remain for years without detection. Many people live with a virus unknowingly, while it silently alters cells and increases the risk of serious complications. The link between HPV and oral cancer is being increasingly studied. What was once considered a problem mainly associated with smoking and alcohol is now also recognized as a consequence of HPV infection. Certain HPV subtypes, such as 16 and 18, are primarily responsible for this cellular transformation. Small lesions in the mouth, which might go unnoticed, can develop into more serious conditions over time. The problem is not only with those receiving oral sex, but also with those performing it. Direct contact with infected secretions and mucous membranes facilitates transmission. And contrary to what many believe, HPV does not need open wounds to settle. It spreads through simple contact between contaminated surfaces, making unprotected oral sex. One of the main transmission routes for the virus. Candidiasis is caused by a fungus called Candida allicin, which naturally lives in the human body without causing problems. However, under certain conditions it can multiply. Beyond normal levels leading to uncomfortable infections in the mouth, it appears as the well-known thrush, forming white patches that cause burning and difficulty. Swallowing the problem is that few people know. This same fungus can be transmitted during oral sex. When this happens, it can affect the intimate area, especially in men, causing inflammation such as balanitis and balanoposthitis. Symptoms range from redness and peeling to intense itching and a burning sensation when urinating. The worst part is that diagnosis often takes time because initial signs can be mistaken for simple skin irritations. Candidiasis also finds opportunities to spread when the immune system is weakened. Common situations such as antibiotic use, uncontrolled diabetes, or even stress can create the perfect environment for the fungus to grow. Small precautions such as proper hygiene and protection during intercourse help prevent this type of contamination, which may seem harmless at first but can become a persistent nuisance. Herpes is a virus that knows how to stay hidden. It can remain inactive for years, and when it appears, it brings painful and uncomfortable sores. The most common type, herpes. Simplex, is divided into two subtypes. Type 1, which usually affects the mouth area, and Type 2, more associated with the genital area. But this does not mean they stay confined to these regions. Contact between the mouth and genitals can cause the virus to relocate, leading to infections in unexpected places. One of the biggest traps of herpes is that it can be transmitted even when there are no visible sores. The virus can be active in saliva or on the skin without showing any signs. This means that a simple kiss or an act of oral sex can spread it without the person having any idea what is happening. And once it enters the body, it never goes away. It may stay inactive for a long time, but it reappears whenever the immune system weakens due to stress, fatigue, or other illnesses. Lesions usually appear as small clusters of blisters that break open and form painful sores. In the case of the mouth, they appear on the lips, gums, or even the throat when they manifest in the genital area. They can be even more uncomfortable, causing burning, itching, and a stinging sensation when urinating. Syphilis was once considered a disease of the past, but it is more present than many people imagine. The biggest problem is that it has a sneaky behavior, going unnoticed its early stages and spreading silently in oral sex. The risk of transmission is real, but few people make this connection after all. When talking about syphilis, most people immediately think of direct genital contact, ignoring that the Treponema pallidum bacterium can enter the body through the mucous membranes of the mouth and throat. The first sign of syphilis is the appearance of a small, painless ulcer called a hard chancre. If it is in the genital area, it is easier to notice, but when it develops inside the mouth or throat, it can go completely unnoticed because it does not hurt. Many people do not seek medical attention, and the infection progresses over time. The bacterium spreads throughout the body, causing skin rashes, fever, and in more advanced stages, severe complications in the nervous system. And heart syphilis is curable when treated early, but the lack of clear symptoms causes many to discover the disease too late. Simply using a condom during oral sex significantly reduces the chances of contamination, preventing a problem that can have serious consequences if not controlled in time. The urethra is a thin and sensitive canal designed to transport urine from the bladder out of the body. Under normal conditions, it is sterile, meaning it is free of microorganisms that can cause infections. But just a small contact with bacteria or viruses is enough to disrupt this balance, resulting in inflammation known as urethritis, and unprotected oral sex is one of the most common ways this contamination occurs. Two of the main causes of urethritis are chlamydia and Gonorrhea bacteria that can be transmitted from the mouth to the urethra without anyone noticing. These infections often cause burning during urination, abnormal discharge, and in some cases swelling and redness. In the intimate area, the problem is that symptoms do not always appear. Immediately, some people carry these bacteria for weeks without noticing anything, which facilitates transmission to other partners. Another little discussed issue is that even common microorganisms from the mouth which do not cause oral problems can trigger inflammatory reactions in the urethra. This imbalance between microbiomes can lead to persistent and difficult to treat infections. The good news is that antibiotics usually resolve the issue, but prevention remains the best strategy to avoid discomfort and unnecessary complications. Oral sex can be pleasurable, but it also requires careful attention. Many people avoid talking about protection in this practice as if it were unnecessary or even exaggerated. However, considering the risks of infections and silent diseases, a few simple measures can make a big difference for your health. Using condoms is still one of the most effective forms of protection. Regular condoms and dental dams prevent direct contact with mucous membranes and fluids, drastically reducing the chances of virus and BBA transmission. Another essential habit is maintaining proper oral and intimate hygiene. Brushing your teeth right before sex may seem like a good idea, but it can actually cause microlesions in the gums, making it easier for infectious agents to enter. Keeping a routine of medical checkups is also essential. Many diseases transmitted through oral sex are silent in the early stages, and regular exams help detect them. Additionally, understanding your partner's health history and avoiding sexual activity during periods of low immunity are precautions that make a real difference. Taking care of your sexual health does not mean giving up pleasure, but ensuring that it happens without unpleasant surprises. We have reached the end of this video, but with information that makes a real difference for your health. Oral sex may seem harmless, but risks exist, especially when simple prevention measures are neglected. Diseases such as HPV, herpes candidiasis, and can be transmitted without the person realizing it. And symptoms often only appear when the problem is already well established. Small habits, such as using protection and paying attention to oral hygiene, reduce these risks without compromising intimacy among all the infections mentioned. Many people are unaware of the link between HPV and oropharyngeal cancer. Had you ever heard about this? Leave your response in the comments. It helps us understand which topics are most real to you if this content was helpful. Like the video, your support is essential for more people to access important health information, and if you want to dive deeper into this topic, check out other videos on the channel about sexual health. There are plenty of contents that can further clarify your questions if you haven't subscribed, yet take the opportunity to do so now and stay updated on all the latest content. See you in the next video.